A 41-year-old mother caught a cold, and taking just one type of vitamin supplement caused her kidneys to completely shut down. This is her story. Ava, a 41-year-old woman, was brought to the emergency room at the University Medical Center with symptoms including confusion, headache, abdominal pain, and breathing difficulties. Her daughter informed the admitting nurse that she had been vomiting several times over the past few hours. Ava also denied any recent travel and told the nurse that her mother did not take any medication. However, when doctors examined Ava's kidney function, they found that her creatinine level was 10.1 milligrams per deciliter. This meant that her kidneys were nearly non-functional, and there was only one way to save her life: she needed to undergo emergency dialysis immediately. Today, we will explore what happened to her kidneys when she took just one vitamin. This video is based on a true story, a real case study published in the journal Chest in 2000. This is a new format for me, so let me know in the comments if you like this type of video and if you'd like to see more like it. The reason I am sharing Ava's story is that there is a very important lesson to be learned from her case. You see, modern marketing is aggressively promoting the sale of supplements that are far more dangerous than most people realize, and vitamins are no exception. If we take a look at what supplement stores offer in terms of vitamins, we can see that many brands sell doses that are too high to be safe for anyone. This particular vitamin is one of the most commonly used supplements that can cause kidney failure, but doctors didn't initially know which one she had taken. Ava was admitted to the hospital in a confused state, and doctors had to run multiple tests to determine which vitamin had caused her kidney function to deteriorate. According to her daughter, Ava had begun experiencing breathing issues about 2 weeks prior. She told the doctors that she had seen Ava vomit multiple times over the past 3 days. She also recalled seeing her mother taking pills, which was unusual for her, but she didn't know what those pills contained. We now know that Ava had been worried about her health and her job. 2 weeks earlier, she developed a sore throat, followed by persistent respiratory symptoms. She was concerned that she might have the flu, so she started taking high doses of a particular vitamin. However, it didn't seem to help, as she soon developed a fever. Busy with work and unable to afford being sick, she bought more bottles of the vitamin and significantly increased her dosage. About 4 days after increasing her intake, Ava went out for dinner and began experiencing abdominal pain. After using the restroom, she assumed she had food poisoning, so she went home and drank some water. She didn't eat or drink anything for the rest of the day because she simply didn't feel hungry or thirsty. Interestingly, she didn't urinate at all for the next 24 hours. So, the big question doctors need to answer now is, what happened to Ava's kidneys when she started taking a vitamin? The doctors had to run a series of tests to determine which vitamin had damaged her kidneys. What they found after a kidney biopsy was acute tubular necrosis and large oxalate deposits in her kidneys. The vitamin Ava took was a water-soluble vitamin. This means that when someone takes too much, the body eliminates the excess through urine. However, if the dosage is too high, as in Ava's case, the breakdown of this vitamin produces a very dangerous substance, oxalate. Oxalate is usually excreted through urine, but in some cases, it can bind to minerals and form crystals, leading to kidney stone formation. Have you ever heard of calcium oxalate kidney stones? This is exactly what happened to Ava's kidneys. The oxalate levels were so high that large oxalate crystals formed, completely blocking her kidneys. But it was too late to do anything. Her only hope was dialysis. The patient underwent 2 dialysis sessions, but after identifying the vitamin that caused all of Ava's trouble, the doctors became concerned. Although this vitamin is generally considered safe, there have been numerous cases of people ending up in the emergency room due to excessive intake of this vitamin. What you see here is another case study. This man took the same vitamin as Ava and lost his life. So, which vitamin caused Ava's kidney failure? Have you guessed which vitamin, in extremely high doses, leads to calcium oxalate deposits in the kidneys, kidney stones, and also causes diarrhea, nausea, and vomiting? I'll give you a hint, this is actually the most commonly supplemented vitamin in the world. It is also very beneficial, and many kidney patients are advised to take it, though at much lower doses than what Ava consumed before ending up in the emergency room. So, what vitamin are we talking about? If you know the answer, write it in the comments. That's right, the vitamin that sent Ava to the emergency room was vitamin C. After 2 dialysis sessions, Ava began to regain consciousness. As the doctors suspected, she admitted to taking large doses of vitamin C daily. She told them that in an effort to manage her respiratory issues, she had started taking large amounts of vitamin C. At first, she took 500 milligram tablets, 4 to 5 times a day. Upon further questioning, the patient recalled that she had begun consuming large amounts of vitamin C pills a few days before her symptoms appeared, up to 10 tablets a day, or 5,000 milligrams. Now, before we return to Ava's story, we need to address a very important question. Is it safe for people with kidney issues to take this vitamin? What we need to understand about vitamins is that any vitamin can cause serious problems when taken in excessive doses. This is the main point of today's video. I always show you the benefits of remedies and vitamins that can help people with kidney issues, but I also always tell you the same thing: consult your doctor and do your research before taking any supplement. Because, as we have learned, even a safe supplement like vitamin C can be extremely dangerous when taken in the wrong dosage. What is the safe dosage for vitamin C? The recommended daily intake of vitamin C is 75 milligrams for women and 90 milligrams for men. The upper limit for all adults is 2,000 milligrams per day. Now, these dosages apply to individuals without kidney problems or a history of kidney stones. If you have chronic kidney disease, especially in its advanced stages, the recommended dose of vitamin C from supplements is even lower, only 60 milligrams per day. For those with a history of calcium oxalate kidney stones, even these doses should be approved by a doctor. So, we can understand why taking 5,000 milligrams of vitamin C per day, as Ava did, was extremely dangerous. Do you want to know how it ended? Did she survive? After 2 weeks in the hospital and 2 dialysis sessions, Ava was able to urinate normally again. On day 14, her lab results showed a BUN of 40 milligrams per deciliter and a creatinine level of 2.2 milligrams per deciliter. These numbers indicated to the doctors that her kidneys were functioning again, and the patient was discharged from the hospital with a follow-up appointment scheduled in her hometown. The next story, a 45-year-old woman's experience with megavitamin therapy. In 1985, DL, a 45-year-old woman, arrived at Columbia Presbyterian Medical Center suffering from loss of appetite, orange-tinted skin, and a broken leg. However, she had to wait because hospital staff categorized her as a low-priority patient. After some time, she began losing consciousness before eventually slipping into a coma. This was when the hospital staff realized that the broken leg was just one symptom of a much more serious issue. Earlier that year, DL had visited a chiropractor for her persistent back pain. While the chiropractic adjustments and massages didn't help much, the chiropractor had another idea. DL, you should try megavitamin therapy," he suggested. DL had never heard of megavitamin therapy before, but since nothing else had worked for her back pain, she decided to give it a try. "It's just vitamins, and vitamins are good for you," she thought. What could go wrong? For a while, megavitamin therapy seemed to be working. Her back pain improved significantly. But unfortunately, the relief was short-lived. Just weeks after starting the therapy, DL began losing weight at an alarming rate. Meanwhile, her abdomen appeared swollen, and the back pain returned, this time with a new symptom. That morning, she woke up too early because she needed to use the bathroom for the 5th time since going to bed. But what concerned her even more was her skin. It had turned almost entirely orange. How did I not notice this, she wondered. That was the moment she began to feel truly worried. While her husband, awakened by all the commotion, tried to calm her down, DL suddenly thought about her broken leg. What I have for you today is a cautionary tale. This story is based on real events documented in medical journals. It highlights the dangers of a specific vitamin, one you should never supplement with recklessly. In fact, you should never take any supplement without consulting your doctor first. A warning: never supplement with this vitamin. Do you know which vitamin is the most dangerous to supplement with? The key takeaway here is that you should never take any vitamin unless you have a specific need, especially if you have kidney disease, diabetes, or another diagnosed condition. And you should definitely avoid high doses. While vitamins can be beneficial when taken properly, all supplements carry some risks, and some vitamins are more dangerous than others. You see, vitamins fall into 2 categories: water-soluble vitamins, like B vitamins, and vitamin C, which the kidneys flush out when taken in excess. Fat-soluble vitamins, like vitamins A, D, E, and K, which accumulate in body tissues. Because fat-soluble vitamins build up in the body over time, they can become dangerous when taken in high doses for extended periods. One such fat-soluble vitamin was what DL had been taking in massive quantities, on the misguided advice of an unqualified practitioner. Within weeks, it caused her to urinate uncontrollably hundreds of times a day. It also led to excessive bone hardening, abdominal swelling, orange skin discoloration, and, ultimately, bone fractures. What happened to DL's kidneys and bones when she started megavitamin therapy? During a physical examination, medical staff at Columbia Presbyterian Medical Center discovered that DL's skin was not only orange but also very dry. Her nails were brittle, and fluid accumulation in her abdomen was detected, causing her stomach to swell. This could have indicated liver damage, but blood tests showed normal liver function. However, her creatinine levels were excessively high, measuring 4.1 milligrams per deciliter, suggesting kidney damage. Yet, this creatinine level alone could not explain all her symptoms. After further testing, doctors finally found a clue: DL was experiencing hypercalcemia, meaning extremely high calcium levels in her blood. They did not detect excessively high vitamin levels. Instead, they found that DL was dehydrated, which aligned with her frequent urination. Before she fell into a coma, there were already signs pointing to the cause: loss of appetite, fluid in the abdomen, brittle bones and nails, orange skin, and extremely high calcium levels. The doctors also learned from her husband that she was undergoing megavitamin therapy, but unfortunately, he did not know which vitamins or how much she was taking. Now, if you can guess which vitamin was responsible for all of DL's symptoms before the doctors reached a diagnosis, write your answer in the comments. The vitamin DL was taking is the most dangerous vitamin, especially for people with kidney problems. We will follow her medical team as they work to diagnose her condition. But if you have a guess at any time about which vitamin is the culprit, write it down. It became clear that DL was suffering from hypervitaminosis, which caused her liver and kidney damage, hypercalcemia, and bone fractures. The doctors knew that no water-soluble vitamin could have caused all these issues, mainly because water-soluble vitamins cannot stay in the body for long as they are excreted in urine, and all of DL's vitamin levels in her blood appeared normal. That left 4 fat-soluble vitamins, A, D, E, and K. The hypothesis of vitamin E toxicity was ruled out because vitamin E has strong blood-thinning effects, and DL was not experiencing excessive bleeding. Vitamin K was also ruled out, as it is used by the body to bind calcium. If vitamin K were responsible, DL's calcium levels would be too low, not too high. Now, both vitamin A and vitamin D are involved in calcium metabolism. Both can lead to high calcium levels in the blood, but only one of these vitamins can turn the skin orange and cause liver and kidney toxicity. Have you guessed which vitamin it is yet? As I mentioned, this video serves as a warning story. It is not uncommon to read in medical literature about people being misled into following treatments that do more harm than good. In many cases, unqualified practitioners prescribe harmful therapies. We have also seen this happen in a case study involving aristolochic acid, an extremely rare case. A woman progressed from normal kidney function to end-stage renal disease in just 8 months. She later required a kidney transplant, and her kidneys never recovered. According to the records, 5 months before her symptoms began, she had been taking an herbal remedy for pain relief, prescribed by her acupuncturist. While vitamins are generally safer than herbal remedies, many people consume them in doses far exceeding the recommended daily intake. This is the basis of megavitamin therapy, which involves taking extremely high doses of vitamins, often many times the recommended daily allowance, in an attempt to prevent or treat disease. Ultimately, it was discovered that this was the root cause of DL's severe health issues. A liver biopsy via the jugular vein was performed on DL. In this procedure, a catheter was inserted through the jugular vein in her neck, guided through the heart, and down to the liver, where a sample was collected. The findings confirmed the doctor's hypothesis: DL had an increased number of fat-storing stellate cells, meaning vitamin A had been accumulating in her liver for some time, causing cell death and scarring inside the liver. This meant that DL was experiencing liver toxicity from vitamin A, and that megavitamin therapy was slowly destroying her liver and kidneys. As I mentioned earlier, vitamin A is extremely dangerous for individuals with kidney disease. It is crucial for people with chronic kidney disease to avoid vitamin A supplements altogether. If the kidneys cannot properly eliminate this vitamin, toxicity and organ damage become much more likely. Even if DL had no pre-existing kidney issues before starting megavitamin therapy, she consumed enough vitamin A to damage her kidneys severely. But the doctors were more concerned about her hypercalcemia, which required treatment with mithromycin. This is an antibiotic that is also used to treat cancer and to bind with excess calcium in the blood. Alright, do you want to know how the story ends? Did she survive? After the second round of mithromycin treatment, her calcium levels stabilized within the normal range, and DL was finally able to come out of her coma. The problem with vitamin A is that there is no way to remove it from the liver. However, the doctors were able to treat her fractures and drain the fluid in her abdomen. But there was nothing they could do about the excess vitamin A, which is why her calcium levels continued to rise. In the following month, she was finally discharged and was advised to immediately stop her megadose vitamin therapy, which she did. She was also monitored as an outpatient for her liver and kidney function. By the time she was discharged, her nail and skin issues had begun to improve, and the swelling in her abdomen had decreased, indicating some recovery from liver damage. However, her calcium levels remained too high for several months. Her liver disease progressed with further abdominal swelling, but clinical evidence showed improvements in other areas, as seen in her gradual return of muscle strength and improved mental state. She was able to regain some weight, and eventually, she recovered. Everyone, I hope you enjoyed this video. If you want to see more videos like this, please subscribe and share this video. That's all for today. Thank you for watching, and God bless you.